everyone. Welcome to Block 3B3, the session on hospital outpatient practice. I'm Yukari Nakano from Japanese Nursing Association, and I'll be moderating this session. This session is part of Planetary Health, a virtual global conference for nurses and midwives, together with nursing professionals from the Western Pacific and Oceania region, and we'll focus on discussing effective strategies for advancing planetary health, particularly in acute care settings and outpatient settings within hospitals. As you all know, today planetary health has become an important global health issue. Climate change and environment degradation are increasingly affecting population health. At the same time, it is also well known that the healthcare systems themselves having a negative impact on the environment. Here's one important fact. The healthcare sector accounts for approximately 4 to 5% of global greenhouse gas GHG emissions. These are almost entirely related to hospitals and outpatient settings. By its very nature, healthcare is an activity aimed to promoting people's health and ensuring their safety. At the same time, it's striking a balance between reducing GHG emissions and the fundamental purpose of healthcare. In this context, there is an expectation that nurses will play a crucial role in supporting sustainable and resilient healthcare system. I believe one of the advantages of nursing professionals is our ability to address that paradox. So now let's get started. We have 3 speakers with us today. Each speaker will talk for about 10 to 15 minutes, and we'll have time for discuss afterward. It is my pleasure to introduce our first speaker, Dr. Gemma Sarabanus from Susan Wakili School of Nursing and Midwifery, University of Sydney, Australia. Gemma, the floor is yours.
Thank you very much for the lovely introduction, Dr. Nakano, and good evening to everyone. And thank you for the invitation to speak with you today alongside my esteemed colleagues. My name is Gemma. I'm a registered nurse, a lecturer and a researcher at the Susan Wakefield School of Nursing and Midwifery at the University of Sydney, Australia. Today I want to share my perspective on planetary health in hospital and outpatient practice. My key message is simple. In hospitals, we must respond, mitigate and adapt to planetary health threats, and nurses and midwives are essential to this work. I'd like to acknowledge that I'm joining from Darug country on the east coast of Australia and pay my respects to Australia's First Nations people and acknowledge their continuing connection to and care of country. This map shows the diversity of First Nations language groups across Australia. Each colour represents a different cultural group. And I want to highlight 2 very different hospitals where I have worked as a nurse. These are indicated by the black stars on the map. Maxfield District Hospital is on Gumbaynggirr country to the north. It's a small but dynamic facility servicing a rural community. And St Vincent's Hospital is on Gadigal country. It's part of a large healthcare precinct in the city of Sydney. These hospitals serve communities with different risks, different resources and different strengths. And I share this to emphasise that context matters in planetary health and the solutions that we bring. Climate change is already affecting health and healthcare in Australia. We're experiencing increased and more intense extreme weather events, and this is affecting individuals, communities, healthcare infrastructure, and healthcare workers. Importantly, the impacts are not distributed equally. Those most affected include rural and remote communities, children, pregnant women and older persons, those with poor health, and those experiencing social disadvantage. We are beginning to see and measure the impacts of climate change, and this is reflected in our hospitalisation data. Over the last decade, extreme heat has caused the largest number of weather-related hospital admissions. Bushfires and storms are increasing hospitalisation related to things like injury, respiratory disease, and mental health. So what does this all mean for us as nurses and midwives? Well, first and foremost, we must be ready to respond. We must be ready to care for people experiencing climate-related health impacts. We must be prepared to respond to climate-related disasters. This is not specialist nursing practice. This is part of everyday nursing and midwifery practice right now. Our second responsibility is mitigation. Global and health system greenhouse gas emissions also reflect patterns of inequity, and we've heard about this from our speakers already today. Those who contribute the least to the problem are often the ones who are most affected. Australia is a relatively high emitter per capita globally, so we have a big responsibility for urgent action. Australia's healthcare system also contributes proportionally greater, so approximately 7% of our national emissions, majority coming from our hospitals. This creates a tension for us as nurses and midwives. We work to improve health and well-being, yet the system we work in contributes to climate change and poor health. Hospitals must urgently work to mitigate emissions as well as waste and pollution. This means delivering high-value, low-carbon care that's sustainable and preventing harm upstream rather than managing consequences downstream. This work must happen at every level of the health system. It must include clinicians and communities, and it must be transdisciplinary and extend beyond the health sector. I want to share a practical solution relevant to us as nurses and midwives, and that is how infection prevention and control, including immunisation, are crucial for delivering sustainable health care. When we prevent infections in our community, we also prevent downstream complications such as hospitalisation, increased length of stay, antibiotic use. This directly contributes to mitigation, to sustainability, and to the resilience of our hospitals and our healthcare systems. On the other hand, infection prevention and control does contribute to some environmental harms, particularly through resource use and generation of waste. This is really important, in particular when we don't apply infection prevention and control practices well and, in according to evidence. In this paper, we talk about the need for investment in infection prevention and control programs to strengthen their implementation, to ensure that they're evidence-based. We talk about the need to measure and mitigate their environmental impact, and we emphasise the importance of people-centred approaches to really harness the power of human behaviour in taking this action. This is a very relevant practical example that comes from a busy intensive care unit in Sydney. This was a nurse-led education project which aimed to reduce the unnecessary use of plastic barrier gowns. It aligned with IPC evidence and policy, maintaining crucial patient and healthcare worker safety. It measured and mitigated the problem, and really importantly, it partnered with the stakeholders and the people and the clinicians in that community. The project cut carbon emissions, it reduced waste, and it saved money. Small changes, when done well, can have a really big impact. Our third responsibility is to adapt. In hospitals, we must become centres of resilience, hubs of community response, and places of refuge. This means things like innovation, system strengthening, and disaster preparedness. It also means investing in capacity building and connection with our communities. This is an example from the new Maxwell District Hospital I shared in the map earlier and the photos in that first slide. The new hospital has incorporated local Indigenous art and culture, showing how hospitals can support healing that is cultural, social, and environmental. Adaptation isn't just about buildings and programs, it's about people, relationships, and trust. Nurses and midwives are central to this work. In these last few slides, I'd like to finish with some examples of how I'm contributing to building health professional capability of nurses in my work and share some actions that you can take. We can leverage relevant frameworks. So, for example, in this paper, we looked at the person-centered healthcare practice framework, and we argue that planetary health is absolutely central to achieving person-centered care and outcomes envisioned in this framework. We can also be active in relevant professional groups. We've heard of wonderful examples at this conference, and here are some more organisations that I'm involved in. Being a member of these groups have been a great source of hope, connection, and positive action. We can also organise and activate our local groups to build capability in our communities. I established a Green Team community of practice in my nursing school a few years ago, and this has been a really powerful community and driver of change. In our nursing school, we're also working to integrate planetary health and sustainable clinical practice into our curriculum to build the capability of future health professionals. We're embedding sustainability in clinical simulation education, working with students, with educators, and industry partners. We're supporting our students to become leaders in the planetary health space by providing opportunities for mentorship and participation in the Planetary Health Report Card. I'll finish with a simple summary. Hospitals and outpatient services must respond to climate-related health impacts and disasters right now. We must mitigate by urgently reducing our emissions, our waste and pollution, and we must adapt by building resilience, preparedness, and community connection. This is all underpinned by person and people-centered solutions and privileging local knowledge, equity, and social justice. Nurses and midwives are not optional to this work. We're the largest health workforce. We're the closest to patients and communities. We're trusted, skilled, and practical problem solvers. Thank you.
Thank you very much, Gemma, for your presentation. We can understand the status and the challenge of planetary health in Australia. Thank you. And our next speaker is Ms. Ayasa Terada from Spring Medical Exchange, Japan. Ayasa, now the mic is yours, please. Thank you, Gemma.
Thank you very much for introduction, Dr. Nakano. Hello, everyone. It's a great honor to be here today. Thank you very much for this opportunity. My name is Ayasa Terada. I'm a registered nurse and public health nurse from Japan and the founder of Spring Medical Exchange. Today, I'd like to share insights of sustainable healthcare in Japan from a nursing perspective. So to begin, I'd like to look at the current situation in Japan. Sustainability in healthcare here is still at an early stage. To illustrate this, I will share findings from a national survey conducted by the Health and Global Policy Institute, or HGPI. This survey provides insights into environmental health among nursing professionals. It was conducted in November 2024, targeting nurses across the country and focuses on climate change and health. This presentation is based on their data used with permission. The full report is also available as a PDF on the HGPI website. Now, let's look at awareness. When asked whether climate change is an important issue for nurses, 72% agreed. So awareness is already relatively high. When asked whether nurses need to learn about climate change and health, 80% said it is necessary. So there is a strong recognition of the need for education. However, despite high awareness and recognized need for education, only 13.5% actually have opportunities to learn. In other words, learning is not systematically integrated but rather fragmented across different settings. Let's now look at actual practices in healthcare settings. When asked whether sustainability-related initiatives are being implemented at the organization level, the results show that implementation remains limited. For example, while waste management initiatives are relatively well established, areas such as digital technology use and energy management are not yet widely implemented. This pattern can also be seen across other areas. Overall, practical action is still not widespread. I came across these findings a few months after launched the Spring Medical Exchange, an initiative aimed at advancing sustainable healthcare. With this context in mind, I would now like to share my work and introduce the activities of Spring Medical Exchange. My journey started with a very practical issue: medical waste. As a nursing student, I saw the large amount of waste generated in clinical settings. At the same time, I was learning about the impact of climate change on health. This led me to realize healthcare must be part of the solution. So, in my first year of university, I started my own project. I visited waste managed companies and spoke with healthcare professionals to explore practical ways to reduce medical waste. Through this experience, I joined an expert meeting organized by the HGPI, where I was introduced to findings of this survey. What encouraged me was that some nurses are already willing to learn and act. I also saw the need to move from awareness to action to implement change in real healthcare settings. At Spring Medical Exchange, or SME, I focuses on two areas. First, education. Second, implementation. Both are essential. Education builds understanding, and implementation brings change into practice. I'm working to bridge the gap between where we are and where we need to be. So, starting with education, we are working with the Alliance of Nurses for Healthy Environments to translate their e-textbook into Japanese. This will be the first environmental health textbook for nurses in Japan. With planetary health being introduced into the national nursing curriculum from 2026, I believe this resource will play an important role. This project is led by a voluntary team of nursing students and professionals with support from St. Luke's International University. We aim to release it this year. However, awareness alone is not enough. So, how can we turn awareness into action? Let me now move on to implementation. In healthcare, medical waste is built into the system, driven by single-use culture and the plastic-heavy practices. So the question is, can we balance safety and sustainability? At SME, I'm working to turn medical waste into value. I'm exploring practical approaches, including recycling materials such as Tyvek. I'm collaboration with companies in Japan. To give you a concrete example, let me introduce Tyvek, a material developed by DuPont. Tyvek is widely used in healthcare packaging, and it is recyclable materials as it's made of 100% polyethylene plastic. This means that not all medical waste is the same. Some materials have the potential to be recovered and reused. However, in Japan, these materials are still discarded. So, what can nurses do? The first step is to understand material differences and separate them appropriately. This highlights the importance of education, not only to raise awareness, but to enable practical action at the point of care. At the same time, we also need systems that make this action possible. Nurses in Japan already work under very demanding conditions, so we should not place any additional burden on them. I'm currently collaborating with Four Stick Company Limited, which is developing the smart waste container called Sumago to explore solutions that reduce medical waste without adding burden to nurses. Our goal is create a system where nurses can contribute to environmental sustainability without extra effort as part of their routine work. This is one of the key principles guiding my work at SME. So why nurses? Because nurses are a unique position to drive change. We are closest to real healthcare settings and we understand what is happening in practice. We are trained in infection control and we consider not only individual patients, but also communities and the environment. This is why I'm working on this area as a nurse and why the active involvement of nurses is essential. Let me now move on to small actions in daily practice. This is not only about waste and it doesn't require large changes. We can integrate environmental perspective into patient care through small, everyday conversations. Even small actions can create meaningful change. In the future, I envision a healthcare system in Japan where nurses play a central role in advancing planetary health, where sustainability is part of everyday practice, where protecting human health and the planet are part of the same care. My work is focused on helping make this shift possible. This is the future I'm working toward. Finally, I would like to conclude with this message. Nurses have both the responsibility and the power to protect people and the planet. I truly believe in the potential of nurses to lead this transformation, and I hope to support them and empower nurses in Japan and around the world to take action. I also look forward to connecting and collaborating with you and taking meaningful steps forward together. Thank you for listening.
Thank you, Ayasa. Your experience will, I think your experience will lead and enlighten the action by nursing in planetary health area. Thank you. Thank you so much. Let's now introduce our final presenter, Ms. Flora Fink, from the University of Sydney and Royal Prince Alfred Hospital in Australia. Flora, please go ahead.
Thank you for the introduction, Dr. Nakano. So hello, everyone. Before I start, I'd like to acknowledge that I am presenting on Gadigal land of the Eora Nation from Australia. I'd also like to pay my respects to elders past, present, and emerging. I'd like to introduce myself. So my name is Flora. I am a second-year registered nurse at Royal Prince Alfred Hospital, a major hospital in metropolitan Sydney. I'm currently completing my honours research at the University of Sydney part-time alongside being a registered nurse. Being a student at the university, I'm also involved in a lot of student-led activities and events, initiatives. In terms of my work experience, as a part of my new graduate program, I spent 6 months on what was at the time the COVID and infectious diseases unit. Afterwards, I spent 6 months on the hematology unit. In the middle of 2025, I returned to my first ward, which I was on, which is now rebranded to infectious diseases and palliative care, comprising of 20 single rooms with a wide range of other specialties as well. Essentially, anyone requiring a single room for isolation will be on that ward. I remember when I first got my registration as a nurse, I was so excited that I encouraged all my friends and family to search up my name on the Australian Health Practitioners list. I was excited to be a part of the team, and I was looking forward to making real environmentally conscious changes since I was no longer a student on a temporary placement. I was actually working permanently. At the same time, I felt quite nervous during that transition from student to nurse, and I didn't have the mental capacity to be thinking much about quality improvement because I was also stressing about learning how to manage my time with multiple patients, developing skills to be a safe and competent clinician. And in those first months, I felt that I was not making as big of an impact in the environmental space as I would have hoped. Not all hope was lost, though, because my passion for environmental sustainability extended to other aspects of my life, as I soon returned to university to commence my honours research, which then helped me feel more confident in making suggestions in the workplace. In my research, we are trying to answer the question of what are the practices and attitudes of nurses relating to non-sterile glove use when administering subcutaneous and intramuscular injections. The reason we are researching this topic is because, as we have established, healthcare produces a lot of wastage, and this can be optimized for the health of everyone and the planet. So why gloves? Gloves are amongst one of the disposable items that gets thrown away quite commonly, and as we know, administering injections is also a common nursing practice in the field. We conducted a scoping review of the current literature, and it is showing a variation in practice, and actions are not always aligning with guidelines for best practice. A major source of waste is from hospitals. They are a big contributor to emissions, and it is a setting where I have the most experience in at the moment, and I can attest that I have witnessed a lot of gloves constantly in use, some of which can be avoided. This is where I feel that guidance and education can be strengthened for the hospital context. Guidance documents from the World Health Organization have deemed non-sterile gloves as unnecessary when administering subcutaneous and intramuscular injections because the risk to blood and body fluid is relatively low. Here is that graphic from that World Health Organization leaflet. So they have deemed that non-sterile gloves are unnecessary when administering subcutaneous and intramuscular injections, much like how we would expect for things like blood pressure, taking someone's pulse and bathing. Our goal isn't to convince everyone to completely stop using gloves, but to encourage people to follow best practice, which could mean changing their behaviors, changing workplace infrastructure, implementing more education dependent on their specific context. The main issue we are targeting right now, before we can make any actionable change here, is to address the lack of understanding on what is driving this variable practice. We want to understand what is contributing to an individual to choose to wear a glove versus someone who doesn't, what factors are at play here, whether that is something we can influence on the health system or something more personalized. The willingness for individuals to change is something that can be difficult. As I have already witnessed at my workplace, there are varying attitudes towards glove use when administering injections, and it's quite interesting to see the rationale. Sometimes it's about habits, following what someone else is doing, or sometimes it's about safety concerns for the patient or concerns for yourself. It's also interesting to see there is a variation in different specialties. I have seen a vast majority of my colleagues working inpatient at hospitals always wearing gloves for subcutaneous and intramuscular injections, whereas those who are administering vaccines in a community setting will not wear gloves. Our scoping review showed us great variation, not only in the attitudes and practices, but also within educational resources, highlighting a need to make more appropriate guidance for varying settings. Although the decision on whether gloves are used for administering injections seems like a very small portion of waste created from healthcare, it has great potential to make an impact on waste reduction when we look at it on a larger scale. I'm really looking forward to continuing this research as we progress this year and begin our primary research, conducting our own data collection and contributing to our understanding of what is driving current glove use. I'd like to end the presentation with talking about being a student and being involved in initiatives within my community. My interest in environmental sustainability also extends into my involvement at the University of Sydney's Waste Fighters Society, which is one of the university's many student-led clubs. I joined the executive team where there were very few of us managing it at the start, and now the team has grown quite large alongside a growing number of members. It's also had its challenges. Since I'm the president, I'm responsible for engaging everyone in this cause and keeping up morale in a world where it seems increasingly difficult to make an impact. Our work focuses a lot on individual actions to inspire greater change. Some events we ran in the past, I popped the photos here. So you can see we did a pickle making workshop where we used the reject or ugly vegetables to make pickles and reduce food waste. We go on coastal walks and clean up alongside the beach and on these walks to get rid of pollutants. We use fabric scraps to make Christmas tree ornaments and other crafts using these scrap fabrics. And of course, can't forget a simple picnic at the end of the semester. Something that I thought was quite cool in the photo down in the middle here. We brought a very large storage container and we cleaned it and we brought it to a sushi restaurant and ordered all of our takeaway there instead of using the disposable takeaway containers. It may not seem very significant, but I believe it's in little actions like this that can inspire organizations to make the right changes. This is something I carry into my workplace as well, because I believe that when others see the effort you put into something that you are passionate about, they can see a new perspective they might not have considered before. Some final words to leave you with. I feel more confident today as I did as a clinician as I did a year ago. And every day I'm proud to be a nurse who cares for humans, but also a nurse who cares about her impact on the environment. I can safely say to any students or early career nurses here today at today's conference, you've got this and don't lose sight of what you believe in. Thank you.
Thank you, Flora. I think we can rethink our daily practice at the healthcare settings through your presentation. Thank you. And before starting discussion, I would like to ask you one thing. For fruitful discussion, there may be time when Ayasa and I are forced to speak in Japanese. I'm sorry. In which case, please view English subtitles. Please ask you, please. So now let's get started. So thank you to all the speakers for your insightful presentations. I would like to use the remaining time to have a discussion with the speakers. At firstly, I would ask about nursing activity in the hospital organizations. Reducing GHG emissions from the healthcare sector often requires decision at the organizational level, and that is often not easy. How should nursing professionals specifically engage in this decision-making process? How do you think? Gemma, what do you think? What do you think about it?
Thank you, Dr. Nakano. A wonderful question, and I think we've all reflected on some of the challenges we experience when working in hospital systems. Often by nature, they're very hierarchical. So when you're working as a clinician at the bedside, it can be difficult to see the pathway for that bigger action. I guess one thing I would suggest, coming from my experience and the work that I do, actually partnering with people who do have those leadership positions, or working towards, acting in leadership positions. So one thing we suggest is actually partnering with your infection prevention and control professionals and teams. They can be a really wonderful ally to work with when we're working to reduce our hospital resources while ensuring we're maintaining that high quality and safe care.
Thank you, Gemma. Collaboration with the people in the different levels or different area is making power to change or discuss the state or present. I think so. Thank you. What think? How about you, Ayasa?
Thank you, Dr. Nakano. And so, yeah, my English isn't sufficient. So I'm sorry. Please excuse me for speaking in Japanese from now on. I'm sorry. 組織レベルの、意思決定に看護師がどう関わるべきかっていうところで、私自身は、看護師っていうのが、先ほどのスライドでも言ったように、現場の声を一番よく知っているというふうに思っているので、現場の声をいかにデータとともに届けるかっていう、そこの存在になれるんじゃないかというふうに思ってます。例えば、先ほどの、メディカルウェイスト、医療ゴミのところで言うと、どの資材が無駄になっているのかだったりとか、どこで過剰な、廃棄が起きているのかっていったところが、現場にいるナースが一番よく、分かっているんじゃないかなと思っているので、その時に重要なのが、単なるこう思いますじゃなくて、患者さんの安全と、あと業務の効率、プラスコストっていうその組織で、解決すべきとこなので、そういった視点と、結びつけて伝えるってことが大事かなと思いますし、先ほどドクター・ジェマが言ってくださったように、一人じゃなくて感染部門とか、あと資材部門とか、病院のいろんな部門があると思うので、そこと連携するっていうのが、看護師一人だとなかなかできないので、連携はすごく、大事かなと思います。はい。すいません。日本語で以上です。
Thank you, Ayasa, and Gemma, and Flora, and the audience. Are you right in English script? All right. That's very important point. Voice of nurses empowered with evidence. Evidence data is needed and powerful. I think so. And Flora, what is your perspective?
Similar to what Gemma mentioned with the hierarchical nature of being somewhere like specifically the hospital where I work, oftentimes I find it's much easier to have conversations with people who are also clinicians like myself, like nurses who are on the same ward as me, having these discussions and making everyone aware and maybe on the same page before we possibly encourage our educator, who is often our main source of contact on the wards, to really raise that with someone who we can't personally contact. So things like that I find are very helpful, and creating that supportive environment for people within that space to talk about these issues is probably the best way to start.
Thank you, Flora. Encourage the nurses if needed, and especially needed. I think so. Thank you. So move to second question. There are often trade-off involved on today's issue. Have you experienced a situation where these priorities conflicted? And how did you handle it? And would you do anything differently now? I think it's difficult to answer, but how about Gemma?
This is a difficult question, Dr. Nakano. We've learnt and heard about the need to understand and work in complex systems. So I think there's always that consideration of the costs and the benefits. I think that's what makes it so important where we can to get the evidence, to measure, to mitigate, and actually to develop a plan. We might not always get it right the first time, but when we're taking that approach, that evidence-based approach, we're learning and we're moving in the right direction.
Thank you, Gemma, and I'm sorry for a difficult question. Yeah. Ayasa, you mentioned about it in your presentation. How do you think about it?
It is very difficult question for me too, but so especially perspective of cost. So コストの面において、特に particularly in Japan、特にその日本では、7割が、赤字の、状態っていう、病院が赤字の状態という、事実があるので、なんかそこと、そこに環境にいいことをしましょうと言っても、なかなかこう難しい、実現が難しいっていうところと、あと、スライドで申し上げたように、日本の看護師、他の世界もそうでしょうけど、すごく忙しい状況にあるので、やはり、プラスの負担をかけない、我慢させない仕組みっていうのが大事だと思ってるので、すごく私もこういう活動をしていると、それってコストにこう直結しないよねとか、あとはプラス、感染の面ですよね。そういうゴミ箱とか作っても感染のとこ大丈夫みたいな話があると思うんですけど、そこ、逆に言うと、問題点っていうのは見えている。コストがかからない、かつ、感染の問題がないってことが分かれば、 病院はそういうことを取り入れるかもしれないっていう、そこが見えているので、今見えている課題をいかにクリアしていくかっていうところに取り組んでいる、トレードオフのその対応っていうところで言うと、課題を一個一個消していくっていうところかなと思っています。伝わりますでしょうか？
Thank you, Ayasa. Yes, it's very difficult time for Japanese hospital in Japan, hospitals in Japan. And I'm sorry, remains time about 5 minutes. So, Flora, I'm sorry. And I have last question. I ask a last question. What are small but impactful actions nurses can take for planetary health? Could you give a concrete example from your own experience? Flora, Ayasa, Gemma, please answer one word. With one word, please.
Small action would be to talk more with people about it.
Thank you. Gemma, how about you?
One sentence, I would say join professional groups and find like-minded people to talk to. Echoing Flora.
Yeah. Thank you, Gemma. And Ayasa, in English or Japanese?
So, small action. So, integrating planetary empathy into health education. So, because I'm a public health nurse, so yeah, that's so.
Yeah. Thank you, Ayasa, and Gemma and Flora. And we had a very rich discussion today. Now I'd like to end on a forward-looking note. The speakers shared specific measures being implemented in hospitals and outpatient settings with practice and study perspectives. We were able to exchange views on the role of nurses in these contexts and the support needed to advance these efforts. As I mentioned at the beginning, in healthcare, particularly acute care, the fundamental purpose of medicine and the concept of planetary health can sometimes present dilemma for nursing professionals. However, I believe that it is precisely because we are nursing professionals that we are able to confront and address these dilemmas. I would like to conclude this session with the hope that each of you here will take today's discussion back to your workplace and where it will lead to further discussion and action. Thank you. Next up are the closing remarks. We hope everyone will proceed to block 3C. Thank you very much for your valuable participation. Thank you very much.